Welcome everyone to BPM Real Talk show. My name is Mark Khabe and I'll be the host of this show. As you all know, we really wanted to establish a platform or a show really where we can invite BPM practitioners from all around the world, from Asia Pacific region, from North America region, from European region, and also in Latin America or any other regions where people are actually experiencing day-to-day basis business process management journey. So we want them to come on the show and talk about their experiences, journeys, their obstacles, their successes, but also most importantly, their failures. So hence we really started BPM Real Talk. So our mission remains the same, to really inspire, inform, and empower the community of BPM practitioners around the world. Today we're going to focus on a really interesting topic. We probably spent a lot of time in last few episodes talking about how do we gain executive buy-in for your BPM initiatives. But today we're going to take a bit of a different twist. So today we're going to actually focus on, not really focusing on executives, but focusing on actually on frontline staff. So today's discussion is going to be how do we gain support from frontline staff who are supposed to really adopt and accept and run with the changes that you embark on deploying. So today's topic is going to be gaining frontline support and what are the different strategies to secure that buy-in from the frontline support for your BPM initiatives. So I want to welcome our guest today, Christopher, who's got probably roughly around good couple of decades of experience in healthcare and as well as various different industries, but especially focusing on process improvement and Lean Six Sigma and TQM type of approaches and methodologies. Right now, Chris actually is spearheading enterprise-wide clinical improvement projects across 12 different hospitals. So he really excels in healthcare sector. So we're going to be probably digging a little bit deeper into the expertise from healthcare industry perspective as well. So he's driven a lot of change management, change implementation, as well as mentoring Lean Six Sigma practitioners to drive this relentless pursuit of innovation and health and improvements into the healthcare industry. So without further ado, let's welcome Christopher Smith. He's a senior process improvement engineer at Centara Health. So welcome on board, Chris, today. And why don't we probably start with a simple thing, really, Chris? Why don't we just probably for our audience, if you can give us a little bit about your background, especially in the process improvement industry for the last 25 years. I would love to hear from there, and then we'll go for some of the questions.
All right. Thank you, Mark. I appreciate you having me on here. My name is Chris Smith. A little bit of background about me. I have over a decade in military medicine with hands-on patient care. Wow. As I was a medic in the Navy and also in the Army as well. What I didn't realize at first was that even in medicine, frontline employee having hands-on patient care, really it's about efficiency. So when time matters, your process matters as well. I have some background in EHR and training that to military doctors and nurses and techs. And then also, belted Lean Six Sigma experience as well. So I'm a master black belt currently. I train yellow belts, green belts, and black belts, and then take on, like you said, enterprise-wide initiatives that goes across, many hospitals.
Amazing. Yeah, you talked about 12 different hospitals, so it's quite impressive actually, and it's quite exciting to hear your background especially from military, and how that sort of translates into this corporate world there. So, well, right. Let's start with a simple structure there. Like everybody talks about, what are the different strategies or the benefits that BPM initiative deliver, but I want to actually look at the challenges. What are the different challenges and the resistance points you probably encountered, Chris, during the implementation of BPM strategies, especially from the frontline staff perspective? I want to focus on the frontline staff for the rest of the show today. So whenever what kind of really the common challenges and resistance you faced from the frontline staff during your tenure?
Well, they're myriad, right? So the people making the widgets, they have their hands full.
Yeah,
You have a certain number of FTE to do, X, Y jobs, and they just don't have time to come off the front line and do things, even though it's required or not required, but even though it's needed.
yeah,
They just don't have the time to come off. Sometimes you even have managers pitching in to help make the widgets. So everybody has their hands full. But the odd thing about it is part of the reason why frontline employees have their hands full is because we're being inefficient. So you kind of feed the monster the more that goes on. You have some people who have been set in their ways. They've been with the organization for a number of years. You hear the things. This is how we do it. This is how we've done it.
yeah.
This is the way things are done. So really different perspectives from that frontline staff.
Interesting. I think you talked about that. It's like the old cliche of you're too busy to improve, right? It's like a vicious circle. You're too
That's
busy
right.
because you're inefficient, and in
That's right.
order to remove that inefficiency, you need to probably alleviate some of your time. So that lack
Yes.
of time and lack of resource availability keep popping up to gain
Hmm.
that commitment for any change that you want to adopt. Now that's a quite common one that we keep hearing. Anything in specific, Chris, that you've seen from a healthcare sector point of view that's probably very peculiar, like for the frontline staff compared to say any other industries?
Um, so I haven't been in the manufacturing space,
Right.
but for healthcare, a lot of our processes matter for the patient's life and their family right now, right?
True.
So yeah, in the aerospace industry, it matters. Automotive, it matters, but you get right up close and personal with your patients and their families, especially patients that are in the hospital for long periods of time. You get to know these folks. You try to help them out as best you can, and I really love the healthcare workers and their compassion and empathy for patients. So that makes you want to try as hard as you can to make things right and to get them done efficiently for your patients and their families. So,
Amazing.
yeah, it's really a sight to behold.
Yeah, exactly. And you hit the nail on the head. I think there is a major impact from the frontline staff compared
Hmm.
to say manufacturing space, where we're actually dealing with people's lives. Now that's quite amazing. So really, if you look at that, how do you really tailor your approach, Chris? Right, because you got frontline staff with various levels of familiarity, various level of authorities inside the business, right?
Right.
How do you tailor your approach to gaining their buy-in, especially when it comes to BPM processes and technologies?
So, what I like to say is, if you look at the organizational chart, there's your structure of your boxes from top down. So, for BPM and Lean Six Sigma practitioners, we really operate in a white space, right? So,
Hmm.
that white space where there are no connections, you're that dotted line.
Yeah,
So, I tell people I'm a herder of cats. I'm a translator because I'm in meetings with executives. I'm in meetings with frontline managers. Then I'm in meetings with supervisors and frontline employees.
yeah,
So you got to give them the with them right at each level. What's in it for me? Um, Trying to get to that frontline staff. It says easy, but it does hard. It makes a lot of sense in the boardroom, but when you go try to do that, it's a totally different story because we have reality at that point.
this is it.
So I tell the executives, look, these are the people actually dealing with your product or service on a day in and day out basis. Things change quickly. That's where the knowledge is. As a matter of fact, that's one of the eight wastes is skills of your frontline employees. I tell the middle management and supervisors the same thing. They're actually the experts at their job. It's not
Yeah,
me. It's not my job to walk in there and say, hey, here's a package. Go ahead and take this and run with it. I ask them, what are your thoughts, the frontline employees? What do you think? What are you seeing? And I usually get pretty good response with that.
amazing. So there's a lot of collaborative approach then you follow, Chris, by the sound of it, to with the frontline
Indeed.
stuff, and that's sort of keen to hear the your thoughts and how do you really engage the frontline staff in the decision making process, right? What BPM initiatives are going to be rolled out, because that would play an important role in automatically securing a buy-in and commitment, right? Because if these are their ideas, so how do you sort of facilitate that, and where do you see their role in decision making process for the BPM initiatives?
Yeah, so it's less about how and more about when. So
Right.
when you initiate the project, that's when you need to engage frontline staff. The how is really easy, right? So you approach frontline staff and supervisors saying, hey, executives are looking at these items. This is something that's a priority. You and your team, you deal with the widgets, you push things out the door. You're the experts. I need your help. Would you like to join our team? Can you join our team? Who do we need to talk to make that happen? So while I can't get as many frontline employees as I would like, I can get one or two in there. And doing it up front, really, it's only about that person getting buy-in. They also talk to their coworkers. They become
Right.
your champion. It's de facto, right? So they know one of them is in the office over there coming up with the solutions. Um, Whenever you wait, let's say you've been working on your solution for a few weeks, a few months, a lot of us sometimes will hear this comment. We're going to go talk to this group over here and get buy-in.
Yeah.
All right. If you hear that, then you don't have buy-in and your project is in peril right this minute because the win is not correct.
So, no, it's amazing. And I think it's like a, and you talked about championing the team leaders, the team members, which then kind of really creates. So one of the interviews we did, Chris talked about a multiplier effect, right? So I think if you get the
Mm-hmm.
right champion on board, it kind of really multiplies that internally to gain that commitment. So it's look, I agree with you wholeheartedly about it's not really is there a choice of getting the frontline staff's commitment. It's just when we need to engage with them. So
That's
if
right.
you consider that really, can you probably talk us to really three distinct examples where in your current job or in previous careers where three distinct examples where you've been able to sort of recognize and celebrate the contribution of frontline staff that have really catapulted in the BPM project success.
Yes. So one of them in the military, we did school physicals for military children. We had a couple to a few thousand that we had to get done over the course of a short time span. The chief doctor came in and got with me, ran down the hall, and said, hey, we have this problem. Can you help us out? And the first thing that I did say was, here are the people, the frontline employees that we need in the room. So
No,
this is kind of the stellar example, right? So we had the chief doctor, we had the nurse, frontline employees, and we all just kind of put our heads together and came up with a good plan. And there was some urgency with the hospital as well. So senior leadership, sponsors, they were actively involved and behind what we were doing. We had to get this done for our patients, and we did do that. Um,
no,
we ran Saturday clinics, about four or five different ones, and all we saw were um, children of active duty military. The very first one that we ran, we actually looked at the process as it was working. It was kind of like a manufacturing type setup because we physically saw patients going from one station to the next through the clinic.
right.
That was a really good look. We saw that we had a bottleneck. We physically saw a bottleneck and made changes, on the fly. And it was our frontline employees bringing my attention to it. It was their ideas, and I was like, "Of course, exactly, go do that." Made the changes. Everybody's high fiving. At the end of it, when all was said and done, the CEO of the hospital, the second in command, we celebrated with everybody via email, via stand up. It was a really good sight to see.
Amazing. Amazing. Any other cases that you probably recall?
Yes. So I would say with some of my nurses,
Right.
they have a very hard job to take care of patients, manage up to the physicians, and then deal with the family members. I've worked on a couple of initiatives with them. The solution is coming up with a playbook. So think of a notebook full of instructions. This is our new process, definitions, A to Z. If you have problems, here's what you can do to fix those, and here are some questions and answers that we came up beforehand. So really getting that buy-in up front. That's where it comes in again. I cannot give this knowledge to them. They are the only ones that have it. So bringing nurses together, doing some on-site all-day events. We've done this several times for several different applications, and then the end product being, here's your playbook, here's your process guide. Take this back out to the field, you managers, and let your employees know this is what's going on. And it wasn't just the people and the nurses that were on site.
Yeah.
We also had them take it back throughout to get a check from the frontline teams as well. Hey, what do you guys think? This is what we're talking about right now. What are your ideas? So we incorporated a lot of ideas from the field along the way. So we baked it in from the front, and it was really good seeing teammates join. So at first, it's kind of like crickets the first time they hear it. The
Yeah.
second or third time back out to the employees, it's like, okay, well, you've given me too much. Uh, I can't actually incorporate all this, but thank you for the input.
It's amazing. And
Hmm.
it's actually quite fascinating when you see, because everybody sort of gets hung up on technological advances and technological improvement, but you just talked about two very simple things that probably
Hmm.
changed the whole outlook and the joy from the frontline staff, right? That hey, it came from us and somebody's there listening to us and incorporating our ideas. It's just got a whole different lens on it. I love the fact that we're really talking about because we continuously focus on executive buying, but I think we don't really talk a lot about the frontline buying and how to really actually incorporate them in the journey. It's quite fascinating. So it's quite interesting to see that you kind of gone and deployed those. So do you have any sort of strategies, Chris, to go back and check the effectiveness of what you've deployed and how it has sort of delivered results and how it sort of realized benefits? Do you sort of follow any strategies or methodologies to sort of assess the performance of the initiatives that you deployed?
Yeah, so it's it's a little bit more art than science. Um,
Yeah.
checking that buy-in, right? So the first thing is if the teams are actually giving us feedback, and we have several different routes to do that, right? So we can be on the phone, we can be on email, you can send out, a survey. You can have the frontline supervisors that are on your team give you
Mm,
feedback as well.
mm,
So that needs to be a back and forth bi-directional communication along the way. So that's one way that you can assess, hey, are you actually reaching the front lines? If that is a yes, then my metrics are whatever the metrics were defined as for the project. Because here's the thing, right? You can have the 100% correct solution, but if your frontline employees do not execute, you're not getting the benefit. It's as
this is it.
simple as that. You can have the carrot and stick that may get you a little ways down the road, but that's not buy-in. Buy-in is when you have frontline employees championing your solution, saying, hey, teammates, this is what we have. This is what we came up with. We're incorporated into this. This is how we execute. That's a totally different matter.
Amazing. Amazing. This is fantastic, Chris. So like you're so you got a regular mechanisms to really solicit the feedback. So that across your 12 different hospitals, you currently probably have got a really well organized feedback mechanism. Is there anything that you probably could share for our audience today, what they could put in place to get the feedback from the front line at bulk quite easily?
Yes. So it depends on the situation, right? So if you're a full time FTE for your organization, it works a little bit better versus if you're a contractor or a temporary employee. But this is a soft skill, but I cannot overstate how important this is. Personal relationships with the supervisors and people on the front line at every site or every unit, however it is for you. You cannot overstate the value of that.
Oh,
A lot of our key players, even in other organizations, I have their cell phone number, they have mine. We text back and forth. If you have an issue, let me know. If I can take care of it right now, I will. If I can't, then all my contacts know. Then I'll research the situation and get back to them in a timely manner as best I can. So that is probably the key ingredient to making all this go. Is I'm not an outsider with these different units and hospitals and organizations. I'm actually one of them. It just so happens that I do Lean Six Sigma and something a little bit different than they do. But I am from the healthcare industry, and they know that I will come and give them the best that I can. Personal relationships, can't beat it.
Amazing. And it's again that, we probably thought that, hey, there are probably tons of great technological solutions that probably you would present to solicit the feedback, but you brought the human touch back in again. It's one of those simple things that it's quite
Hmm.
fascinating. I'm sure, Chris, probably you can talk about this till the cows come home, because I can see you're very passionate about the frontline staff things there.
Yes.
But look, we are running out of time for today. But really, I appreciate you taking the time, Christopher, today and sharing some really key, simple, but effective, valuable insights and lessons on how do we go about securing the frontline staff buy-in. And again, thank you very much for sparing the time. We really appreciate it. To our viewers, thank you for joining us today, and would like to remind you to stay connected with BPM Real Talk. And we have more exciting episodes coming up, each with its unique perspective and inspiring stories to share, like Chris today. So be sure to subscribe, follow us, and stay updated on our latest episodes, and enjoy our growing BPM community of enthusiasts. So, Chris, again, thank you. Really, thank you for your time.
Thank you, Mark.